Jennifer, one of the questions that I get most often is, how in the world did this happen so fast? Don't doctors take the Hippocratic Oath to first do no harm? And so can you explain sort of the short version, even though I know you could provide a very long history of this, but how did the collapse of biomedical ethics happen such that now, and we're going to see this in your film trailer later, that a teenage girl can, within 30 minutes of a telehealth call consultation, can obtain synthetic testosterone from Planned Parenthood, whereas before, that was not even a question. There would be many hurdles to stop her from doing something so drastic. How did we get here so quickly on the biomedical ethics front?
Well, as Brandon said when he introduced me, I did spend about 20 years in clinical nursing, specifically pediatric critical care nursing. And just to, maybe this is the hopeful side, is that, this isn't the first time that medicine has lost its way. I mean, think back to what doctors were doing at Nuremberg, during Nazi Germany. Think about the Tuskegee studies that were done for several decades in the United States on men with syphilis. I live in California, which was the biggest abuser of involuntary sterilization, where we, would sterilize predominantly women, sometimes men, that we deemed not fit to reproduce. So this isn't the first time that we're witnessing a moment in time, a moment in history where medicine has lost its way. I am old enough to remember when I graduated from nursing school, we still had to wear the little white hats. And we had doctors, and we had patients, and we had respiratory therapists, and we had phlebotomists, and now we have healthcare providers. We have, when I left nursing, I no longer had patients, I had customers and clients. I was told at the last hospital I worked with was to refer to my patients as my customer or my client. And we would have client, surveys. How satisfied were you with the service that you received? So that was a big shift in just our view of medical professionalism from, doctors as a medical profession. And, we used to believe, doctor knows best. And we sort of swung that pendulum to the other side where now the consumer knows best. Now we've become consumers of medicine. I walk in, I show up, I say, doctor, I've done the Google search. Here's what I want, here's what I have. I need you to order a CAT scan. I think I have a broken, whatever. So, we see our shift in being no longer patients, being served by physicians, a trusted covenantal relationship with our physician who we know and trust is not going to do any harm to us or encourage us to do anything harmful. To he's just the provider of service. And then finally, I think this I say often, and people are usually shocked. If you're in medical school today, you do not have to take medical ethics. It's an elective. You can take it if you're interested. Part of me wonders out loud, maybe that's not such a bad idea, because if you think of the Old Testament and everyone did what was right in their own eyes, you only get medical ethics as good as whoever's teaching that medical ethics. And you only get medical ethics as good as the values and the beliefs of the person who's instilling an ethical framework for how you're going to make sure that you first do no harm. So I think those are a little bit of little breadcrumbs along the way to sort of explain how we got here today. But I am the eternal optimist, so I'm hopeful as we look back at these moments in time where medicine lost its way. And most of the time, the reason medicine got righted was because of whistleblowers, lawsuits, and the mass collective voices. So you all can go out tonight and have your megaphones.
Very quickly, follow up. Where do you think that this is now marketed to children, though, that children are actually consumers of medical services?
Why do I think that is?
Yeah, well, it's broken down so much that now even minors are seen as this.
Well, when you think of the children as the patient, who is consenting, who is being informed of the procedures? It's parental. So parents are consenting to this. And I think overwhelmingly it's follow the money. And medicine, like academics, like the media, like the cultural elites, has been captured. And so they want to be the popular people at the professional society meetings that are on the right side of history. So I think part of that is money driven, but also, being captured by, this is the new standard of care. This is how we treat these children.
Jennifer, to wrap up this first portion of the panel, our first panel, let's talk about detransitioners. This page. Tell us, who is this group of people? I think 2022 was kind of a banner year for them, as I saw increasing media coverage, even in mainstream outlets, profiles of detransitioners, these people who underwent experimental medicalization, hormone surgery. I know you've got a book coming out soon, patterned after a documentary film that we're going to see the trailer for here soon. But tell us more about what we're seeing, these brave young people who are increasingly saying things such as, this transgender identity was all a mistake. I didn't understand fully what I was getting into, what it entailed medically. I'm irreversibly harmed by it. I regret it. What's going on with this group of people?
Well, first, I don't believe in transgenderism. I think that's a lie from the devil. So just a little bit about words and language. There's a word called a desister, and then there's a detransitioner. So a desister is somebody who never took medical hormones and never did any surgery. They thought they were born in the wrong body, so they changed their name. They were Susie, now they go by Tom. They were he, her, now they go by him, them. They cut their hair short, or they used to wear it long. So that's a desister. They've never done anything medically, but they desist and they wake up and go, oh, that was a joke. That was a lie. The detransitioners are people who actually go the step of medically and surgically, sometimes just medical, but oftentimes it's surgically. So they alter their body in the deception that they can change sex. So these people are, and Dr. Van Mol alluded to it a moment ago in his remarks, these are young children, young adolescents, young adults who have all kinds of comorbidities. They have trauma, they have childhood trauma, maybe they were sexually abused, maybe they were physically abused, maybe they were bullied, maybe they were autistic. Maybe they had a history of self-harm or suicide attempts. These are troubled young people. These are vulnerable young people. And because we live in this toxic environment where we have told people that they can change sex, and we've told them that this will help you, these young now detransitioners have bought into that lie, and they've tried to alter their body. And what happens is, all those problems that were never addressed, the trauma, the depression, the autism, all those issues were never dealt with. So they do all this, and you know what? They don't feel any better. It didn't work. And so they say, I have all this harm physically to my body because of taking medications that the female body was never meant to have in it, like high doses of testosterone, or vice versa. A male body is not supposed to have high doses of estrogen. They've had surgery that's caused all kinds of complications because we're not supposed to chop off healthy parts of our body. And it should be of no surprise, we would need no medical training whatsoever to know that when you start doing surgeries and taking things off the body that are normal and healthy, maybe things don't go right. So, these are the detransitioners. And we don't know how many there are. All we know is it's growing. There's a subreddit group, which is I don't like to ever plug social media because but there is a group, and it's a detransition group, and it's boasting some 40,000 members in that group now that are all talking about how they believe the lie.
That's probably only a fraction. That's probably.
And part of it is because a lot of people, when they detransition or they desist, they don't make a big announcement. They don't say, hey, mark it down on my chart, doctor, that I'm this now and I'm not that. So there's a lot of people that just carry on with their life. So they kind of go unnoticed. And so in the United States, it is a growing number, and we talk about the social contagion, and it's because, like Mary talked about, these kids are being sucked into social media that's telling them these lies. Hollywood, all the movie stars, all the young actors and actresses who are now coming out as non-binary and gender fluid, whatever those words mean. But that's sort of the landscape of what's going on here.